respiratory tract. My skin is irritated. I don't know what's wrong with me.
We need to go to the doctor. Let's go.
I'm Dr. Bailey. You must be Rachel.
Yes.
And then you must be Aubrey. So your friend Rachel was telling me about all the symptoms you had, and that seems like a lot. But I think I got a drug here that could really help you. What it is, it's known as under the class of penicillins. So it's called amoxicillin. You might know it better by its trade name, Amoxil. So like I said, it's a classification of a penicillin. And what a penicillin does is it has proteins in it that bind to, it's a bactericidal antibiotic. And the proteins in penicillin bind to the peptidoglycan in the cell wall of bacteria, and it inhibits its growth, so it can't grow anymore. And what's nice about amoxicillin is it's a broad spectrum drug, so it kills lots of microbes that are causing all these different symptoms you have.
Well, that's great. Yeah, that sounds just what she needs. What are the contraindications of this drug?
So the only major contraindication of a drug under the classification of a penicillin would be an allergy to any penicillin. So do you have any allergies?
Not that I know of.
Okay, well then that'll be good for you then.
And then when and how does she take this?
So the typical adult dose we do is 250 to 875 milligrams every 8 to 12 hours. And that is probably what we're going to give her, somewhere between there.
Whoa, doctor, I can't take pills.
Oh, that's okay. Amoxicillin can come in a lot of different things, actually. It comes in capsules, tablets, chewables, and liquids. So you can do the chewable or the liquid if you would like.
Okay. Side effects of this drug, such as vomiting, diarrhea, lethargy, urticaria pruritus, and Stevens-Johnson's disease. Is that true?
Yeah, those are all very common adverse effects of amoxicillin. But the one Stevens-Johnson syndrome, that is what we call an idiosyncratic effect, which is something that doesn't normally happen, but it has happened before. So because of that, you would want to give me a call if you experience any excessive bleeding or you start to develop a rash. You could also call me if you have any symptoms of kidney or liver failure as well, because those are reactions that are not considered normal and could be potentially dangerous.
My friend said that she had permanent nerve, muscle, and tendon damage. Is that possible as well?
Yes, there is what we call a black box warning on all penicillin and amoxicillin drugs, and that reaction has occurred before. But again, it's very rare, but it is on there because it can happen.
Okay.
But it's very unlikely. And then just to be sure, are you pregnant?
Not that.
Because penicillins are classified as a pregnancy B category drug, which means it really shouldn't be any harm to you or the fetus if you are pregnant, but I just thought I would let you know. And then with dietary restrictions, you actually don't have any. So you can take this with or without food. If you take it without food and you get an upset stomach, go ahead and take it with food. And if the nausea is persistent and doesn't go away, we could probably figure something else out. Do you have any other questions for me?
No?
Okay.